courage is not just one of the virtues, it's the form of all virtues at the testing point. And and we are testing courage now as the organizations have to do things. If they are going to fight this, are going to have to speak up and in some cases suffer the consequences.
There's an old military adage that plans are useless, but planning is invaluable. No way you're going to make a disaster plan that things are going to go the way you planned it, because disasters don't go the way that you planned them. They happen different times, different places, and all of that. Our biggest problem with Katrina, I think, was a lack of planning and expertise, and probably and lack of good leadership at various levels.
So we can remember what's possible, which is that courage can be contagious, love can be organized, right? And movements that can not just challenge systems and policies that create harm, which of course they must, but can also nourish our soul. Being overwhelmed is absolutely appropriate. Being outraged is absolutely appropriate and natural. My thinking is whatever the next thing is, there's a lot of work to do. HR1 is now law. There's a lot of work to be done to prevent the harms of this and the other policies that are marked by cruelty, extremism, and corruption.
But primary care has a triple superpower in the United States. We're important because when you have really competent practices that are equipped to see all their own patients the same day they're sick, you keep people out of emergency departments, which consume a huge amount of money. So one is you keep people out of emergency departments. Two is primary care is public health. Boots on the ground. Primary care practices are the places where people get evidence-based prevention. So you save a whole bunch of money by preventing the diseases of the future. And the third is primary care practices are the places where we can do the best chronic disease management. You just need a good team to be able to do that.
I think to be human is to care. And I think that has multiple dimensions. It is to care about the state of the world, to care about all those things we want to tune off of our attention in terms of changes in policy, the fate of populations that are under violence and existential threat. We need to care for and about each other in our communities, and we need to take care of ourselves.
And your strapline at the beginning is like it's really difficult for nurses to speak up in the workplace, despite a lot of, initiatives to help nurses do that. It's still, people feel suffocated, they feel bullied, they feel harassed. There's all sorts of pressures that are applied to stop nurses from actually articulating